right? We got matrix bands, wedges. We have to check all that as well, stuff like that. So always remember to break your procedure down by what surface. And then as a rule of thumb, so you don't get in the dental assistant curse. The dental assistant curse, I'll tell you all about it. If you don't set it up, you're gonna need it. And then you're gonna be gloved up one day and your doctor's gonna throw a curve at you and be like, yo, I need, we got a filling down here. Since we just completed this facial 5, let's just do this filling here since you're here. And then you only set up for that facial 5. So every time, it doesn't matter, your doctor will always try to get more treatment, especially if it's a class 5, took 5 minutes to fill. Let's do something else. So he might say, let's do tooth number 30, DO. And then you're gonna be like, oh, well, I gotta go get some stuff. That's the dental assistant curse. If you set up for simple extraction, you're gonna turn surgical. So you always set up for surgical. And then you just put the instruments away that you don't use. So just so you know, just kind of break it apart and avoid that assistant curse because your doctor will throw you curve, promise. Okay, let's see if we got all our setup here. Tell me what's on the setup. Somebody? Anybody? Sonia, what you got up there?
Okay. High speed with 330 or 35 Burs.
Okay, here's my high-speed handpiece. Remember, new students, write it down. If you need, use the back of your paper. It's blank. The high-speed handpiece is a 1 unit. Okay, this is going to open the tooth or start the prep. So this is our prep instrument, 1 piece. Next.
Slow speed handpiece with 2 or 4 round Burs.
Okay, your slow speed is a 3 unit. You have a motor, you have a straight, and you have the contra angle. Okay, so you need those. This actually removes decay at a slower speed than the high speed.
Basic setup.
Basic is in our setup.
Anesthetic setup.
Anesthetic is present.
Rubber dam.
Rubber dam. In 14 years, if you want to make a side note, I have never done a composite with a rubber dam. So for this checkoff, we're going to skip all those steps.
Spoon.
Okay.
Redefining instrument.
Yep.
Edge.
Yep.
Bonding brush. Bonding holder.
Yep. We need not a problem. It's there.
Bonding liquid.
Uh-huh.
Gun.
Composite gun?
Oh, it doesn't say
Composite?
Okay.
Comprimers?
Yeah. Composite material. Shade guide.
Shade guide, yep.
Composite placement instrument.
Okay, so let's stop real quick. We're going too fast. Because I got some new students, I keep forgetting. So we got a mirror, Explorer, my air water syringe, cotton pliers, and articulating paper. This is a basic. Okay, this is what we call basic. They are labeled blue, so they're always going to be together in the setup. So that's what it asks for. So those are all those that we need. And then she asked, oh, will you put those back in order? I'm going to take them off. Then she asked for a spoon. This looks just like a spoon. You want to touch it, hold it. Okay, spoon excavator removes decay with the hand, so it's a cutting instrument. Then she said refining instrument, this proper name is a GMT. So what we do, that actually levels. So when I use a burr, it's not level. So I'll take that instrument and make sure everything is like level, like a floor or door. Make sure it's even. So that's what that instrument does. It's the second one. Composite placing instrument, it looks just like a Woodson, except this one's black. That's how you know that it is just strictly for composite. Some of those are silver with gold ends or working ends. Those are also going to be an indicator for composite, or it's just going to be plastic. And it looks just like a Woodson, and the proper name is actually plastic instrument, or they call it composite placing instrument, and then a spatula. So those are our instruments. When they said anesthetic setup, we basically get our syringe and This has topical gel on it. We just pretend that it's there. And then we use a gauze, and then I'll explain why. So this is the setup for that. And everything is color coded. Everything in your instrument should be all blue. So when we go into sterilization, you could just toss it in there. And then once you start banging it, you put all the blue instruments together. Okay. Where are we at now? Sorry.
Plastic matrix.
Plastic matrix. So we need our plastic matrix is for anterior. So this is a matrix band. What is a matrix band? Please, the senior, tell me.
It's such a cute little like natural contour of the tooth.
Natural contour of the tooth. What's missing though? If I use this matrix band, your mesial and distal, so your proximal surface that's missing from the tooth is your mesial and distal. I know you guys don't know what it means, but I will explain and draw, because I promise you'll get it, okay? So our mesial and distal, which means our right and left side of the tooth, is missing. So if I didn't have that strip in between, I will bond the teeth together. And then now I'll have one big ginormous tooth. Okay? Good morning. What else? Light hearing unit. We got a very old one. Okay, this is an old one. I thought I saw a new one, but I think that belonged to Mrs. Meekins. It was green. It was sitting over there. Did you see it? It was like a wand. Yeah. And it had like a charger and base. Ooh, those are so new because you don't need to take this big machine. Like, that looks like a blow dryer, right?
I know.
Alright, so it looks like a blow dryer, but it's actually a curing light. So they have wand ones, which is nice. It's cordless. You don't have any cords to mess with or things like that. So there's different types. So we got that?
Yep. Finishing strip.
Finishing strip. We got that. I'm going to pass that around. So if we have any proximal surface, what are they again? Mesial and distal. So if our proximal surface is missing, now if we have material that hangs over, so if this is my tooth and I have material hang over like that against my hand, I'm going to take my finishing strip and just take whatever that was hanging off and make it even. So that's all it's going to do is make it my margin even. Okay, articulating paper, we talked yesterday about our bite. So we have to make sure we get our bite. What surfaces do we check if we need this instrument? What surfaces do we need to work on? Occlusal, incisal, lingual, especially for upper anterior, because if you think when your patient bites, your teeth, the lower, hit the lingual. So if we're working on the lingual side of that tooth, we have to check the bite, make sure that's even, or occlusals, and then our incisal edge for upper and lower.
Composite finishing burrs with paper and tape.
Oh, finishing burrs. I got a grip of them. Okay, so I know you can't see my little burrs. They're here. So I did something last mod. This is my finishing paper. So if you look at the flutes are what matters. So this is my cutting high speed. Okay, high speed here. We have a 557 or 330 burr. That's what they first mentioned with my high speed. High speed has an end that looks like this. It's friction grip. Each of these burrs access the tooth and start the prep. Flip it over. This burr is actually our slow speed burr. Has a different type of end because it gets locked into the device. And they have different sizes of rounds. So that's why I printed that. And when they say size 2, we're just going to look for a size 2 burr. And then it's going to be according to the roundness. The bigger the number, the bigger the round. Okay, so this is our carbide cutting burrs and removal of decay. And then this page is our finishing. So we got finishing burrs here. They're usually gold. So if you look at my burr block, these two here that I'm moving right now, these are our finishing burrs. Okay, the flutes was what changes it. This is my cutting burr, this one as well. These are all my cutting burrs. This is a mandrel that sticks my disc if I need that. So I have just examples of it. So here's my finishing burr. More finishing burrs here. It could be a flame, could be a ball, rubber points. We also have my mandrel and disc. We could have some more rubber points. We can have this little brush. All these do is just polish the amalgam and make it smooth and slick, because if it was rough, then plaque and bacteria like to adhere to rough surfaces. So we just place a filling that attracts plaque instead of not. So that's why we need these. Then I have examples of finishing strips. Also, again, different types of discs and mandrels. So you get them up close. I have a few pages of those.
Polishing disc and
Polishing disc. Okay, this is it. I just got a big one so you can see. This one actually goes into my straight. So we would have to take my contra angle off. And then it'll go into my straight. And now, if I use a disc, these are only for facial and lingual surfaces if this happens, okay? So that's how you can tell. Any other of the burrs, you can use in any other position or surface, just depending on what we're doing. Like a flame would be class 5, so I can get underneath that gingival tissue. So it doesn't hurt. Okay.
polishing points and lips or lips.
Okay. All right. So she's going to show you how to pass. When we break into teams, they'll break it down and you will be shown how to pass. So I'm a two-handed pass. This is my basic pass. The first thing you want to do when you pass this to your doctor's just verifying we are working on whatever tooth we're working on, making sure decay's present, making sure that he actually treatment planned everything correctly, which he did, I'm pretty sure. Yeah. So she's passing me now my topical gel and some gauze, because we're going to start getting him numb. My gauze is to wipe the saliva from the inside of the cheek, and depending if we're working on upper and lower is where I'm going to wipe. So if I'm working on a maxillary, I'm going to wipe right above the tooth. If I'm working on the mandible, I'm going to do in the corner, because the whole block or the whole jaw for the mandible gets numbed. So the whole corner of the jaw will numb the whole left or right side, depending on where I'm working. On the maxillary, if I'm working on 6, I'm going to numb 6. It's just different for the top than it is the bottom. Okay. She passes my syringe, making sure that my thumb is in the hole, my fingers got the grip. Depending on your doc, we're not doing it here though. We're just going to make sure that nobody gets extra poked. We're just going to stay safe. Your doctor may require you to take off the cap and expose the needle. You're going to drop the needle here if he has you do that, because he needs to get back to it. And then he'll go in and do his injection, and then he will recap. He will never repass this back to you to recap it, because that's just another way for you to get poked, and it's against the law. So you know what to do. She's going to give a full mouth rinse, and we are on what step number? They're going on the side, so that's what they're reading. Okay, so she did a full mouth rinse, because if you guys want to taste this, there's some, if you put your finger, once you take this out and you're over there, if you want to taste this, this is gross. It tastes like, I don't even know what to say it tastes like. It tastes like nasty water. Very bitter, nasty water, so that's why we rinse our patient. Shade guide. So she's going to wet the shade guide, because the shade will look better if it's wet, because our mouth is wet. So, and then she's going to turn off my light. In my office, you turn off the light. Some offices, you will turn the light away, but I'll show you the difference. If she turns the light away, you see this yellow hue, you're going to get it down here, so you're going to get a false reading. So in my office, always turn off the light, and then you can get your shade. So she's just going to match the shade, because if we're working on a front teeth, you want your shade to match, right? You don't want to see yellow to white, or other way, white to yellow. Yep, ask the patient, see if they like it, especially if it's a front tooth. Remember how you would feel about a front tooth filling? They're going to feel the same way. Let them approve it. Fine. It looks good. What shade did we get?
One.
I asked her what shade because that goes to your progress notes, and you're going to add that in your progress note. Okay, shade B1. All right, so my patient got numb. She took her shade. We waited for the time to get numb, and now it's time for a high-speed Burs. Okay, so we'll do different services. We could do a class 5, we could do an occlusal, we can do a DO. We'll kind of speed this up. We're going to do the same, tooth number 6, facial 5. Pass the cotton roll to retract. The cotton roll will help keep the lip up and out of the way. And then I'm going to do a facial class 5, tooth number 6. Then I should be on what step? Slow speed. When I get my slow speed, that should be dry, that prep. So let's go ahead and burst some air. If it's not listed, add that to your procedure. Air, that was water. Oh, I needed air. Sorry.
On slow speed.
It should be locked, but there we go. So this air. Okay. All right, go ahead and rinse. Then dry, because I just created debris. Next up should be spoon excavator. So in an office, this will change. Most of the time, the doctor will cut all the decay out with a handpiece, and you probably will never even pass this. But just so you know, that must mean there's some decay still left, that my handpiece will take too much tooth structure away, so I need to remove it by my hand. And you pass this. That's why you pass that. Now, if my refining instrument, if my prep isn't even, if it has corners and dips and ledges, we have to make those even, otherwise our filling will look horrible. And then rinse and dry, because those were hand cutting instruments. Yep, and the next, what does it say? Okay, this is phosphoric acid. Remember, okay, as a great dental assistant, never pass it never pass the syringe, usually it's smaller, but never pass etch if it doesn't work. So always test before you give it, or before you sit down, glove up. See how I'm squeezing really hard? Nothing. My doctor's gonna struggle. He's going to squeeze so hard, it might go all over the patient's face. Always check this etch before you pass it. Make sure that you can squeeze it. Big tip is to check it before you even sit down, because you don't want to check it when it's time, because now you're wasting time. So you want to make sure that it comes through. This one sucks. Make sure it's just not that, okay? It's not the syringe. There we go. So, it works. Now you can pass it. This only goes inside the prep on each wall that the prep is. You can't put it on any other surface or tissue, only the prep. And how long? Okay, 4, 5, 6, 7, 8, 9, 10.
So it would be 10 instead of the 30.
I can't hear you.
Oh, it would be 10 seconds instead of the 30.
Right, yeah, so cross that out and it's 10 seconds.
Should I have one from up here?
Yeah, so another thing, you want to hover, so you want this up here like she's doing, and then if you spray, it will go directly in there. There you go. Perfect. Okay, so depending on your doc, if you want to do a side note, when you rinse, you have to rinse for the 10 seconds as well. And when you dry, maybe dash of air instead of completely dry, because if you completely dry, we just desiccated the tooth. That's what it means. We desiccated it, which means we over dry, and we can harm the tooth again. So make sure you just kind of like burst of air. That's it. If your doctor wants you to completely dry, let him tell you completely dry. Okay, bond, that's why we need it completely dry or somewhat dry. We're going to put bond on this time. And bond only goes in my prep. So you're going to see me dab it a few times, take it to the tooth. Add a side note, an Anna or doctor will always do a burst of air on the tooth to make it thinner. So bond, we're going to burst some air to make it thinner. And then she's going to cure for 20 seconds.
So, if we do use a matrix and wedge, will we place it before the edge or no?
Yes, so put that note there as well. Good question. So we don't have any mesial or distal surfaces. We're working on facial. So if we are working on mesial and distal, that's prior to etch. So your matrix band is always before etch, not after. I'll tell you why. If you put a matrix band after, you're going to draw blood, saliva, things like that, and then you're going to have to re-etch. So then that's acid again, and we're opening the tooth longer than we should, so it'll make the tooth sensitive.
Gotcha.
Okay, so we were on the bonding stage. Okay, she cured for 10 seconds. She passed me my composite. Just as a tip, always pass the composite tip either up or down, whatever. Help the doctor out just a little bit. And then he'll go straightly to there. I'm going to squeeze it in there. And then we're going to mold. So I don't know what your step says, but don't forget you pass your composite instrument to mold it to the tooth. And then get some gauze to wipe off my excess material as I'm molding, because I don't, if we cure the excess, that means I have to trim it off later. So that's why I'm taking as much excess material off the tooth now prior to cure, because I don't want to remove it later. I want my filling to be almost done before I cure it. Okay. And then we cure again, and then 6 facial. Don't forget to cure. Some offices want you to cure 40 seconds, and that's every beep. Some offices want you to cure 10 seconds, 20 seconds. Just make sure your doctor knows, or you know your doctor.
Right here.
It could change.
You want 30, right?
Yeah, I want 30 seconds.
And every beep is 40 seconds?
No, so on this blow dryer type,
Oh,
you'll
so
set your beeps.
Okay.
So we haven't heard a beep yet, but it's probably coming up on 20. On a new handpiece, it always beeps at 10 seconds.
Okay.
Or new curing, not handpiece, curing. All right, then she passes me an Explorer after I had placed my material and cleaned it off, because I want to make sure I have no excess. I'm also going to see where I'm going to trim, if I need to trim. If I have any overhang, check my filling for hardness. I'm checking all of that right now. I got a little bit of overhang right here. So since I have an overhang right here, I'm going to use a finishing burst of flame, because it's going to go into that gum, but it's not going to cut the gum. So take that back, change my handpiece, change my burr to a finishing. And then Okay, after you finish, let's check again. So he'll just re-verify after we do any type of finishing. Oh yeah, it's smooth. So the reason for Explorer, we want to make sure it doesn't stop or catch like this. See where I'm having trouble? That's where it keeps smoothing. So here, see how my Explorer just glides? That means we are great. So we are done actually with this filling. Post-op.
Alright, your restoration has been set. Do not eat anything for 2 to 3 hours till your numbness goes away. When you floss, just floss going sideways. Do not pull through. Do not eat anything hard or sticky, such as peanut butter, candy, or anything of that sort. Do you have any questions?
None. Don't forget, here, put a side note. In Composite, we don't have to say you don't avoid sticky or hard. Why? Because it's really hard. So there's no temporary cement or anything like that, so they can eat whatever they want. Flossing, cleaning, still the same, just the numbing. That's it. Oh, and bite. So if we worked on the lingual surface of 6 instead of the facial, maybe we'll check the bite. Oh, and then we'll remind him. So when you become unnumb, when you eat, if you notice something different on this tooth, come on back. We'll do an occlusal adjustment. And that's what we were doing yesterday. Okay? That's it.